So what exactly is ABA? Well, ABA is a heavily researched, evidence-based strategy. And what does that mean? What it means is that ABA takes a bunch of different theories and procedures that have been collected and reviewed over the last 70, 80 years, and we apply them when appropriate to specific clients or to specific settings or environments or even workplaces. And there's ABA interventions for all different kinds of people, places, settings, and environments. ABA primarily right now is being used for people who are on the spectrum that have the diagnosis for autism spectrum disorder, or ASD, and it's also used for several other diagnoses and even children who are atypical and have regular behavioral issues. So it's not just restrictive to just people who have autism. It can also be used on all different kinds of populations, and so it's not very specific in that sense. Basically, if it has behavior or its behavior can be affected, then ABA can be used as a strategy to either increase or decrease the behavior that you want, or remove behaviors that you don't like, and by replacing them with an actual appropriate replacement behavior. As we know, we can't just get rid of behaviors. Once a behavior is learned, it can't be erased. So the only thing we can actually do is create a functional replacement behavior and teach that skill to the person. Once we teach this new skill, then over time, if it is an effective strategy, it should take hold, and then that should become the skill that the person then uses to access the environment. Now, what is the actual definition of ABA? The definition of ABA is that it is a system of procedures and applying interventions, drawing from theory that is all ABA researched over the last, like I said, 70 years, and it's supposed to be used to improve socially significant behaviors. What does that mean exactly? That means that it's supposed to be used for improving people's life, their quality of life, their access to their needs and their wants, from others in the environment, or just to be able to access themselves on their own. And it's a extremely effective strategy, especially if you're consistent in the application of the procedures that you're instructed to follow. The other thing about ABA is that is very important, is that we take data. The data is what drives the decisions that the analyst should be using to create programming for the client, or for your child, and it should be used to guide whether they're going to continue to follow up on this skill, or whether it needs to be modified, or whether, if the behavior is not coming down or it's not increasing, what should be done or in order to change that outcome. And it can be all kinds of different types of procedures from the library of stuff that we use: PECs, redirection, planned ignoring, pre-MAC principle, a series of different behavior tools that we use in order to modify behavior. We then review the data afterwards, and then we can make decisions as to whether it's working or it's not working, and go forward from there. And the behavior analyst should always be reviewing the data on a weekly and daily basis when they're seeing the client, and also they should go over this data with you and discuss it to you. And if you don't have a clear understanding of what it is that's being instructed to you or explained to you, then you should always feel free, without any feeling of not having confidence. You should always have confidence when talking to your analyst and asking them whatever questions you feel like you are not sure about, and also about interventions that you're not sure about and why they're actually being applied. You should also have a relationship that's a two-way street with your analyst about what you feel is comfortable and what you don't feel is comfortable when applying interventions. And so these are really important things. Now, the analyst should be following these certain standards of service, which they've been developed since 1968 by Baer, Wolf, and Risley, and they're the 7 dimensions of ABA. And those 7 dimensions are generalization, that's applied, that it's behavioral, that it's technological, the intervention, that it's analytical, that it's conceptually systematic, and also that it's effective. Now, what does that actually mean? Well, we'll start from the top. Generalization means that when they teach a skill, that your child is actually learning the skill and being able to apply it in a new environment or a new setting, and even sometimes in a new environment with a new person, and they, without any prior instruction, they complete the behavior. Next, what does it mean when they're talking about that it's applied? The applied dimension. Well, the applied dimension means that the behavior is socially significant. So it's something that's going to improve your child's life, or their quality of life, or their access to the environment. When we're talking about, is it behavioral? We're talking about, is it observable? Is it something that you can see? Is it something that you can measure at the beginning and the end of when it's occurring, whether it's a problem behavior or a skill that you want to teach? Or when it comes to the term effective, what we're discussing is it actually making a change? Not statistically. Is it actually making a meaningful change in your child's life? That is what it is that we're looking for when it's talking about, is the treatment effective. Next, we go on to conceptually systematic. Is the analyst using a procedure that is coming from the literature, or are they inventing something off the fly? Typically, sometimes we improvise as behavior analysts, but for the most part, we should be drawing from theory and literature that is on file, that is peer-reviewed literature. And what that means is that a series of analysts have sat down, reviewed this procedure, done it over and over and over again, and they know that this procedure is exactly the way that it's written down, and that it works the way it's being stated it works, or that it doesn't work the way it's being stated it doesn't work. That's part of it as well. The last thing is that it is technological. And what does this mean? This means simply that when they're writing the intervention out for you, that it's clear and it's concise, it's easy to understand, that it's repeatable, and that anyone can repeat it, even a person who is not trained in ABA, that by simply reading this procedure or the set of instructions, they could follow it to the T. And that's basically it. Oh, the last one is analytic. And that has to do with, like I said, coming back to the data, that the treatment is analytic in nature, and that the behavior analyst is reviewing the data, going over it, and making decisions for the programming based on that data, and not just, we're going to change something because it's not working. But how do we know if it's not working? Well, we have to actually look at the data. That's how we're able to tell. And so that's pretty much the basics of what is ABA. And good ABA services also include coordination of care. That means that the analyst is going with you to different healthcare providers. They're looking at the goals that they're working on, and they're combining them with the discrete trial training, which means working one-to-one with your child, and incorporating those other providers' goals into your goals and the home goals, so that we can all be on the same page and the client can progress, or your child can progress at the fastest rate possible, which is what we want. We want to be able the child to progress and keep advancing as quickly as possible. So this is all good things to look for when you're looking for your analyst. They should be coordinating care with you. They should be reviewing your data. They should be discussing with you why interventions are being put in place, and they should generally help you finding resources. Your analyst is a wealth of resources, and they should be able to point you in the correct direction for anything that you might need. And if not, they should be able to speak to one of their colleagues that could then put you on the direction that it is you're looking for. If you have questions related to specific topics, feeding, speech, occupational therapy, all of those different things, you can all get all of that information from an analyst. So it's always important to have a good relationship and a good communication relationship with your analyst, and that they're keeping your goals as well as the goals that they feel are the most of concern to be able to have your child progress as quickly as possible. So that's about it for today, and I want to thank you all for watching this video, and if you can hit like and subscribe, and thank you for watching this video, and come back for our next one.